Hello everyone, my name is Ahmad Ifam Yasi. I'm year 26 student. So today I'd like to talk about the usage of eye shield. Learning outcome of the usage of the eye shield is this education session is designed to help you understand the purpose and the importance of using eye shield after eye surgery or injury. Learn the correct way to wear, remove and care of your eye shield. Last but not least, recognize sign and complication, know when to seek medical attention. So, the diagnosis for the usage of eye shield is you may use the eye shield as part of your recovery from cataract surgery, corneal transplant, laser eye surgery or LASIK, ocular trauma or injury. For example, a common situation in the usage of eye screen is to protect your healing eye. Right. The learning outcome. By the end of this session, you will be able to explain why the eye shield is important for your recovery, demonstrate the proper application, removal, and security of the eye shield, maintain the eye shield in a clean and safe condition, identify early sign of infection or complication, know when to contact your healthcare provider. Thank you. Right, you also need to know the advantage and disadvantages of using the eye shield. The benefit of using the eye shield is it shields your eye from dirt, dust, and accidental bump, prevent you from touching or rubbing the eye, especially while you are asleep. Aids is faster, safe healing by maintaining a protective barrier. Help to reduce exposure to bright light following surgery and minimize the risk of infection. The possible drawback is you may feel slightly uncomfortable at first because it can cause some skin irritation or pressure mark from the tip or the bands. It may fog or feel warm in humid environment. Also quite a tedious thing to do because it requires regular cleaning to avoid infection. Good morning, sir. My name is Ahmad Ifam Yasi and I am year 26 student. So first of all, how are you today?
I'm feeling a bit better than before.
Right. So I've seen your medical chart, and what is your name?
My name is Jeremy Grijit, anak Clement.
And your ID number?
My IC number is 040129101141.
Right. I've heard from the doctor and also seen your chart that you are already undergo LASIK for your right eye. How is it?
It feels okay for now.
So today I would like to talk about how to protect your right eye during your recovery. So our purpose to you to use eye shield to protect your eye when you're sleeping, so it doesn't put any pressure on you, or when you're going to public or being exposed to dust. Right. So Mr. Jeremy, I got a mirror for you. So I'll place on your tongue so that when I demonstrate, you'll see how I will do it and how I apply eye shield for you. Right. So this is an eye shield and this is my purple. So how to apply an eye shield? So first we need to open it. And we will need 2 pieces of the microphone. I would suggest for it to make a long one, so it is easier for you to apply. Right. So how's the placement for the eye shield? Is the tip will be on your forehead and the round one will be on your cheek. So you may look in the mirror. So this is how your eye shape placement will be. Right. So, by using the micropore, I'll stick the first one on the top without blocking your view. Then I will cut the excess. Right. Here. Here. Then another one. The bottom. And right here. Without blocking your view. So you can still see through the eye shield. Right. So I hope you remember the step that I demonstrate to you. So when you discharge from the hospital, you can apply it yourself at home. Right. So there's a few things that you need to know when you are using eye shield. So the eye shield, you need to clean the eye shield once a day, and usually you only use it during when you are going to sleep, or when you're going to the public, or when you are exposed to the dust. Right. So do you have any question about the usage of the eye shield?
Do I need to use this when I go to shower?
You need to take it off after you shower. You will need to reply.
Alright. Okay.
Okay, so
Okay.
so I'm going to ask you to demonstrate how you're going to apply it for yourself, so that I can assure that you will use the eye shield properly, and then you have a fast recovery. Alright, Mr. Jeremy, so I'll hold the mirror for you, and I'll ask you to demonstrate the proper way of using the eye shield.
Okay. So as told by you just now, so there are two items that I need, right?
Yeah.
Which is the eye shield and also the micropore.
Yes.
Okay. Okay. Since this has like two parts, the round part and also the teeth, like you said just now. Okay. Okay. Do you? So is it like this? Like this?
Yeah, like that. The tip will be going to your forehead, and then the round part will be on your cheek.
Okay. Wait a minute. I check out the micropore first. As long as it is enough to cover the whole eye shield and attached to my skin, it is alright, right?
Yeah.
We need to
Yeah.
write.
Totally.
First, I need to, like this, right? Am I right?
Yeah.
Then I need to put the top one first.
Yeah.
Alright. Let me get that. Can't really see well.
Yeah. So keep. Oh, okay. You stick it there.
Okay. Can I see the mirror? Okay. And then the second one is on the bottom, right?
Yeah. But don't block your view.
So I know it may seem not that tidy, but is it like this?
Yeah. For a beginner and the first time, I think it's quite good for you.
Yeah.
And actually, can you see well through the eye shield?
Yes, I can still see well, and it does not block my view.
Right. So, thank you for your operation, and I hope for a fast recovery for you.
Alright, okay. Thank you so much, Ness.
Thank you. It's Jeremy. Right, Mr. Jeremy. So I would like to share some of the how you need to take care of the eye shield. So the first one is you need to wash it daily after uses. So you will just need to wash it by running it under the tap water and then with the soap. Or you just need to use the wet tissue. You just need to wipe it or the cloth. Next, you will need to inspect for the mesh. So
may I ask?
yes.
For the damage, how do I know if the eye shield is damaged? In what kind of damage are you talking about?
Right. So the damage that I'm talking about, if there's a part of it that's broken and it may cause some injury when you apply it, and there's a broken part or the pieces is not in the same place, so you need to replace it.
Okay.
Right. Next, you will have to apply it very carefully, and you don't need to put it too tightly. Just feel as it snap it on your eye properly. Right. Next, you will need to store it in the dry and clean place in a container, for example. And then, if you want to put it or use the eye shield, you need to wash your hand first to prevent from any infection. Last but not least, the eye shield is a personal use and you cannot share it with other patients or other people. Right.
There are some side effects when you are using an shield. So the first side effect is it may cause some irritation, mild irritation due to the tape. Some patients are allergic to the tape, but I wish you are allergic to the tape. I assume.
Yes, I should really no problem.
So the other one is when you are using it for long duration, it might cause duration because it might have some water retention or it will block the film.
Okay, I want to ask, since I just started you currently use this eye shield, right? So how long when you use this eye shield? Is it about 1 week, a day, or maybe a month?
Alright, so it's a nice issue. Of course, it is less right. So I suggest to instruction, you need to wait for about a week. So if you notice any changes to your eyes appearance, if there are redness, swelling, or discharge or pus, and then you need to modify your care provided immediately.